morning and welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Good morning, everybody. I'm Rhonda Lahnert.
And I'm Chuckalicious, Chuck Williams.
And a good friend of the show has joined us this morning. Last week was Tinnitus Awareness Week. And matter of fact, I had a friend just diagnosed with this recently. It affects more people than you know. A lot of people don't realize how many people are affected by this. But the sad thing about it is most don't know. And
Right.
Dr. Haley Owens from Livingston Hearing Center is joining us this morning to talk a little bit about tinnitus and the awareness of it. Good morning, Doctor. How are you doing today?
Good morning. I'm doing great. How about yourself?
I cannot complain. Now, let me ask you, what is the Awareness Week all about with tonight?
Tinnitus is the presence of a ringing or buzzing sound in the ears. And Tinnitus Awareness Week is really just there to bring awareness to this effect and to, let people know what causes it and what they can do about it.
I have a kind of a specific question on it. Is it always a continual ringing and buzzing, or can it come in just like little, every now and then you just hear a little, it's like a bell or something?
Yeah, sometimes it comes and goes. In most cases, when it's the most bothersome, it's something that is there continuously. But some people experience it in one or both ears, and sometimes it's intermittent.
Now, well, I hate to call it a disease, but I guess it could be termed as one. This can be brought on at a very young age and make itself manifest as you get older, correct?
Yeah, it actually is not age specific at all. In most cases, it's actually related to a hearing loss.
Whoa.
This could be a hearing loss that people don't even know exists. It can be in the very high frequencies. The damage there causes that ringing effect to happen. Right. But a lot of times these people that experience this don't even know they have a hearing loss. They communicate fine. They hear fine, but they have this damage in the very, very high frequencies that causes this ringing to happen.
To follow,
Go ahead.
follow up to that, I understand that a lot of children have this bone or something that they can hear very sounds that I can't, and because they lost something, does that have any weight on tinnitus or what?
Well, they may be hearing sounds you can't because of their age, and maybe because they haven't been exposed to as much.
Okay.
But hearing loss is not an age-specific disorder. Oftentimes it's from what we're exposed to. Whether that be noise exposure, sometimes from getting a little bit older. Sometimes there's some medical conditions that can cause it as well. But in many cases, it's age-related.
Doctor, are there any products on the market that can help someone battle this? Is this something that we can work toward a cure maybe, or is it just a treatment thing for the time?
Unfortunately, there's not a cure. And in some cases, we actually don't even know what causes it. But in cases where it's hearing loss related, the best treatment actually is treating the hearing loss. If we amplify in the frequencies where that hearing loss exists, many, many times we can manage that very well. It's not a cure, though. It's something that, we can get it to, we can reduce it or sometimes even eliminate it while we're wearing the device. But of course, when you take that device off, a lot of times that ringing will still be there. Often, there's actually many cases where people with normal hearing, no hearing loss at all, and they experience this tinnitus as well. Now, sometimes this can be symptoms of a hearing loss that hasn't quite shown up yet, or they could just have normal hearing and they're experiencing this ringing as well. And in those cases where amplification won't work, there's also what they call tinnitus masker devices, which basically generates a sound that can help to cover that ringing with a sound that just blends into the background a little bit easier, makes it less noticeable.
Huh.
Are there any things that we can do to prevent tinnitus on a daily basis just to protect our hearing that you would recommend?
Yeah, the best way is to protect your hearing. So when you're going to be around loud noises, protect your hearing. Try to be further away from the noise. Especially in the summer months when we're looking at mowing lawns and 4th of July fireworks, things like that. Anytime that we can either be further away from the noise or wearing hearing protection, that's the best way to protect your hearing. And with that comes protection from tinnitus, given the two are pretty well connected.
Are we Well, in our business, we wear headphones every day, you know, and this can actually do more to further tinnitus than anything else, can it not?
It can, and noise exposure is really about the amount of volume and in combination with the amount of time. So if you're going to be around loud noises or you're wearing headphones, I'm sure you're not wearing them for 8-10 hours a day.
Right.
So and if you can rest your ears for some time after being exposed to those loud sounds, you're going to be in a better position to not experience as much of that noise-induced hearing loss.
And a good edge to that is, Doctor, tell us a little bit about some recent studies that have linked hearing loss and cognitive decline.
Yeah, there's a significant link between untreated hearing loss and cognitive decline. It's actually one of the most treatable connected things with cognitive decline, right? So the longer we go with an untreated hearing loss, the greater the chance that we have, we're not using our brain. And so since it's not stimulated, we're going to experience some decline from that. If we can treat the hearing loss, now it's not a cure. It's not going to say that you're not going to have any cognitive decline, but it definitely sets you up in a better position to reduce the chances of that cognitive decline.
And so some of the things we would want to look for, I'm just guessing here, is like you have to turn the TV, way up, just to get the show or whatever's being said. You're asking people to repeat things.
The first signs we typically see, tinnitus actually is one of them. Starting to notice more difficulty in background noise. Having to ask people to repeat, not necessarily because you can't hear them, but you just can't understand the words that they're saying, right? And hearing loss, a lot of times at high frequency, and this is gonna affect the clarity of speech more than the volume, right? You hear fine, you just can't understand the words. So those are kind of the first things. My patients tell me when they come in and those mild hearing losses, or they're not sure they have a hearing loss, but maybe everybody mumbles. Well, if everybody mumbles, it's probably not them. Chances are it's your hearing.
Probably not everybody.
Probably not everybody.
I mumble. Doctor, I want to ask you this. Unlike other ailments or other things that happen to the body, people, when their eyesight gets bad, I know a lot of people have no qualms going to get glasses or going to get cheaters or whatever it is. But hearing is a different animal altogether. Sometimes it's hard to get somebody to cross that threshold because they associate it with, as Chuck would say, being vintage, and they don't want that number on them yet. What are the first steps? How do you address the tinnitus? I always wanted. Am I mispronouncing that? Tinnitus. Is it? Yeah.
Technically, it's correct at tinnitus, but we'll accept either way. It's kind of a regional thing, and it depends on where you are. People pronounce it both ways, and it's really correct either way. So,
how do we get across that threshold to come into an office?
It's funny. There's stigma attached to hearing aids. I love the term vintage. I'm going to start using that. There's stigma attached with hearing aids or hearing loss because we associate it with aging. And because when I start to wear hearing aids, I must then be old. I think it's gotten a lot better, kind of in recent years because people know, the connection to cognitive decline. We prefer to treat it sooner rather than later. But there is still some degree of stigma attached there. So, the best place to start is just getting your hearing checked. We love it when we find normal hearing and we can just tell you, hey, let's wait another year. But when we do find out that there's a hearing loss, the sooner we can treat it, the better. So just, coming in, they're so much smaller than they used to be. They don't have to be what we call the big beige banana behind your ear. Right? They're so much smaller. We have some that are completely invisible. And frankly, they're kind of cool. They attach to your phone now. We can get streaming directly into them. They're kind of like customized headphones at this point that also can treat the hearing loss and treat the tinnitus as well.
A good friend of mine, Mr. Whitaker, used to be a teacher, taught my brother. He has them now. He has the aids now, and he thinks it's so cool that he can just sit there and talk on his phone and Bluetooth it in, and he thinks that's the coolest thing. He loves it.
It's pretty cool. You can have your music playing, walking around listening to music, and tuning the wife out, or
oh yeah,
whatever your way is.
I think Mr. Whitaker does it to tune people out. I mean, he does that. What did you say?
I think that's why my dad won't wear hearing.
Won't wear his hearing aids. But the thing about this is, it's not an age thing. This happens happens to young kids. This happens to children. This is a generational thing. And the first step is taking that step, because it can really be devastating. You withdraw, especially if you're older. You feel like you're a burden because you're always saying what, or you're missing out. You don't want to be social because everything sounds like static or away from you. For children, it can lead to learning difficulties. Hearing is just one of those vital tools. And one of the worst things about it, or the sad thing, it doesn't get better. It does. It's not something you let it go and just say, well, if I just stop listening to loud music. No, it's not going to get better.
That damage is permanent. And, I think the big thing is your hearing loss is a journey. And at Livingston, we want to be there every step of the way for you. It's not like eyeglasses where you get them and, you don't see your optometrist again for a year, maybe two. Hearing aids require maintenance. And we want to be there for you every step of the way, and just making sure that we're taking care of the hearing loss and staying on top of it as it gets, as it progresses throughout the years. We just want to be part of the family, or have you be part of our family.
That's it. And Livingston Hearing Aid Center is just that, the family. People rave about it, how you're treated, how they approach the treatments, the options they give you, and they offer a free hearing test. And that's all. Just take that. You might have good news. They might say you have perfect hearing, life's good, or they can get to a problem, either detect it early or start working on it now, so you can live a full life. Livingston Hearing Aid Center is located right here in Amarillo at 1600 Coulter Street, Suite 105A. Give them a call at 806-553-6695. And like I said, be a part of that family and get back into life. Like I said, I know some people have withdrawn because of hearing issues. Guys my age, guys I served with, because we were around loud noises. They've just withdrawn. They've just said, I don't want to do that. I don't want to do this. I don't want to go to concerts anymore. I don't want to be social, because they feel embarrassed that they have to say what, or they have to get right there. You don't have to live like that. You don't have to shut your world off like that. And Livingston gives you a great opportunity with a free hearing test. Give them a shout at 1600 Coulter Street, Suite A, 105A, 806-553-6695. Dr. Owen, thank you so much, as always, for some great information.
Absolutely. It's good seeing you guys.
Good seeing you again. Once again, take that first step. Or if that person is the loved one in your life, or you have a child that's having some difficulties, Livingston Hearing Aid Center, they treat you like family. We'll take a break. We'll be back to wrap up this Friday edition of The Chat on Newsday Amarillo and News Channel 10-2.